The top stories tonight in Y News. Octa research fellow Dr. Guido David says the national government could have waited for the positivity rate to go down further before downgrading Metro Manila's alert level.
Senate Blue Ribbon Committee recommends filing of criminal charges against Health Secretary Francisco Duque in connection with the alleged misuse of pandemic response funds.
Election Commissioner Rowena Guanzon says one commissioner could not also vote on the consolidated disqualification cases filed against presidential aspirant Ferdinand Bongbong Marcos Jr. Good evening, Philippines and the world. Today is Tuesday, February 1, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am Herlene Delgado.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. Octa research fellow Dr. Guido David says the national government could have waited for the positivity rate to go down before downgrading Metro Manila's alert level. Aiko Miguel will tell us why live. Yes, Aiko?
Yes, Harleen, good evening. Octa Research Fellow Professor Guido David explained the national and local government considered the 40% decline of hospital care utilization rates in areas that are considered low risk. Reason why they have decided to de-escalate the epicenter of the pandemic, the National Capital Region, and other provinces to alert level 2. But the national government could have waited for at least 2 weeks for the positivity rate to drop a little, Professor David said.
Personal opinion ko lang na baka pwedeng nahintay natin na bumaba ng konti pa yung positivity rate kasi medyo mataas pa yung positivity rate, nasa 17% pa, pero bumababa naman. I think in 1 to 2 weeks baka nasa less than 10% na rin. Hindi naman kami against the alert level 2. Ang perspective ko lang baka pwedeng nakahintay ng mga 1 or 2 linggo lang.
Harleen, Professor David also said a resurgence is still possible in NCR, but it is not yet projected to occur in the coming months. Octa Research is also seeing a downward trend in other provinces placed under alert level 2. NCR may also be back to low-risk classification in the next 2 weeks.
Yung resurgence sa ngayon, Yusek, dahil nakita natin na yung BA2 Omicron subvariant andito na rin, kumalat na rin. So hindi ako ganun ka concerned sa resurgence. Hindi naman sinasabing hindi tayo mag-iingat. Mag-iingat pa rin tayo. Pag nag-iingat tayo, most likely hindi naman tayo magkakaroon ng major resurgence as long as efficacious pa rin yung mga bakuna natin. Kaya kailangan syempre patuloy na magpa-booster shots sa mga kababayan natin para para tumaas ulit yung yung efficacy nila, yung protection nila against the virus.
And based on Octa's projection, COVID-19 cases in the whole country may decline to 10,000 by mid-February, but before further dropping to around 5,000 by late February.
Yung projection sa mid to late February, ayun nga, sa buong Philippines, ang pinaproject natin, bababa na to less than 10,000. In fact, by late February, I'm expecting baka malapit na sa mga 5,000 cases per day na lang. Nakita naman natin na mabilis bumagsak yung bilang ng kaso, ganun sa South Africa, pati sa Metro Manila.
Harleen, the country has been recording over 10,000 daily COVID-19 cases since January 5 amid the threat of Omicron variant of concern. And that is the latest live. Back to you, Harleen.
Thank you, Aiko Miguel, reporting live from Quezon City.
Meanwhile, the Philippines recorded 9,493 new cases of novel coronavirus disease or COVID-19. However, DOH stated that all labs were operational on January 30, 2022, yet 10 labs were not able to submit their data to the COVID-19 document repository system. Tuesday's tally brings the total number of cases to 3,569,665. Of this, 4.9% or 176,053 are active cases. Among the active cases, 164,995 are mild, 6,133 are asymptomatic, 3,070 are moderate, 1,529 are severe, and 326 are in critical condition. DOH also reported 24,210 new recoveries, bringing the total to 3,339,558, or 93.6% of the total number of cases. On the other hand, 51 more have died from COVID-19, bringing the death toll to 54,054, or 1.51% of the total number of cases. Meanwhile, the overall global COVID-19 caseload has topped to 378,460,745, while the deaths have surged to 5,674,493, according to the Johns Hopkins University. The United States is the worst-hit country with the world's highest number of cases and deaths at 74,942,273 and 886,687 respectively. And in terms of infections, India follows with 41,469,499 cases and 496,242 deaths. In terms of deaths, Brazil comes second with 627,589 fatalities.
The Department of Transportation suspends the no vaccination, no ride policy effective today. Public utility vehicle personnel expressed relief after its implementation was put to stop. Asher Kadapan Jr. will tell us why live. Yes, Asher.
Arlene, several public utility vehicle personnel in Quezon City explained that no vaccination, no ride policy has been a burden to them. This is because they are required to check the vaccination status of every passenger utilizing the PUVs. Their income were also affected as passengers who have yet to be fully vaccinated are prohibited in public transport in Metro Manila, while the region is under COVID-19 alert level 3. But as the Department of Transportation suspends the policy effective today after the metropolis shifted to alert level 2, the PUV workers find relief in their operation.
Kada sakay nila, hindi namin kailangan i-check o may ID ba kayo ng vaccine. Tsaka yung kada sakay baba, yun yung inano namin eh. Kasi trabaho rin talaga namin yung laging magtatanong.
Kaya mas okay po ngayon kasi dire-diretso na yung akyat yung mga pasahero. Tapos yung iba, di na rin nagdadalawang isip na umakyat kahit di po sila vaccinated kasi pwede naman na.
Some passengers also support the suspension of the no vaccination, no ride policy amid the threat of COVID-19 infection.
Para sa akin lang it's much safer kung fully vaccinated yung mga bumabiyahe kasi hindi lang din para sa mga fully vaccinated yung ganung paraan. So for me, kung hindi ka vaccinated, I guess you should stay at home.
Mas okay po. Kasi para mas safe lahat. Kasi malaki din naman tulong ng bakuna actually. So, nakikita naman sa numbers.
Kung ayaw nila magpabakuna, ayun ang protocol ng government eh. Kung ayaw mo sumunod, manatili ka sa bahay mo para hindi ka mahawa at hindi ka rin makahawa.
While there are passengers who find the policy unnecessary due to the activities of other people despite the restrictions.
Marami naman pong nakikipaghalubiro rin, nakikipag-inuman, nakikipagtrabaho. Lahat po ng mga communication naman po is person sa person naman po. So okay po yung hindi vaccinated po.
Arlene, the PUV personnel expect to have a more convenient operation as regular work resumes tomorrow. Arlene.
Thank you, Asher Kadapan Jr. reporting live from Quezon City.
And in other news, the Department of Tourism is gearing up for the country's reopening to foreign leisure travelers next week. This despite being listed in the U.S. Centers for Disease Control and Prevention, or CDC's Avoid Travel Advisory. Rosalie Cos explains why.
On February 10, all fully vaccinated foreign leisure travelers from visa-free countries will be allowed to enter the Philippines. This as the Philippines started to ease its entry protocols for fully vaccinated international passengers. For almost 2 years, this is what the tourism industry has been looking forward to.
Our confidence to ease travel restrictions comes from various initiatives undertaken over the last 2 years. And of course, we are very strict with the implementation of health and safety protocols. The reopening of our borders to international travelers in just a few days' time will be the strongest sign yet that the country's tourism industry is on its way to a full recovery.
However, the United States of America released a new traveler advisory against 12 countries, which include the Philippines, due to high rates of COVID-19. Based on the assessment of the U.S. Centers for Disease Control and Prevention, the Philippines is at level 4, COVID-19 very high level. The U.S. agency warns its citizens to avoid travel to the Philippines. It adds, even if an individual is up to date with COVID-19 vaccines, including booster shot, the person may still be at risk for getting and spreading COVID-19. Apart from the Philippines, the U.S. travel advisory also includes Singapore, Mexico, Brazil, Ecuador, Paraguay, and 6 more nations due to high transmission rate of COVID-19. The CDC now has around 130 countries with COVID-19 cases regarded as level 4 COVID-19 very high risk. Rosa Licoz, UNTV News and Rescue. We serve the people, we give glory to God.
Indoor and outdoor businesses may open at 50% of capacity as Metro Manila and other areas are downgraded to alert level 2. JP Nunez will give us the details live. Yes, JP.
Arlene, good evening. With the increase of operating capacity in indoor businesses under Alert Level 2 restrictions, store owners and managers expect to regain their loss from the previous stricter restriction. Business indoor operation under Alert Level 2 is increased up to 50% capacity and 70% for outdoor services. A coffee shop in Quezon City can now accommodate twice the number of their customers for indoor services. From accommodating more than 20 customers under Alert Level 3, they can now accept more than 40 individuals with the easing of restriction to Alert Level 2 starting today.
Sa ngayon po, baka kakayanin na po siya ng mga 50% to 60% po. Dito po kasi sir, kumbaga sa isang branch po namin, maliit po kasi siya. So, dito ang kakayanin lang po talaga, ang pinakamarami na po is dumating is 40% lang po talaga.
Customers who accompany kids and those partially vaccinated individuals are now free to travel as mobility restrictions for unvaccinated individuals is lifted. A restaurant in Marikina City also expect their regular customers will return with their families and their children as minors were not restricted. An eat-all-you-can restaurant in Parañaque City, which also has branches around Metro Manila, will now accept their employees who are relieved during stricter alert level restriction. Arthur Benedicto, the operations manager of Cabalen Group of Companies, said some of their branches were forced to shut down due to pandemic. Some of their employees were relieved from work and finds another job aside from small medium enterprise. Even larger businesses asking the government for assistance caused by pandemic.
So sana bigyan kami ng government ng tulong para naman makabawi kasi talagang lumubog halos lahat ng restaurant dito sa ating bansa. Talagang we are the first, I think, na apektado talaga dito sa pandemic na to. Sana man lang the government will support us like in the form of tax. Baka pwedeng wala muna kaming tax na bayaran for this pandemic or in a form of loan para makabawi naman kami sa business na zero interest, something like that.
Arlene, business owners and managers hope that there will be no more lockdown imposed and the threat of COVID-19 will finally end this year. That is our latest live. Back to you, Arlene.
Thank you, JP Nunez, reporting live from Quezon City.
Comm Comelec Commissioner Rowena Guanzon disclosed that Commissioner Amy Perolino has defeated not only her vote on the disqualification cases filed against presidential aspirant Ferdinand Bongbong Marcos Jr. Dante Amento tells us why.
Comelec First Division Presiding Commissioner Rowena Guanzon constantly accused that Commissioner Amy Perolino is intentionally delaying the release of her ponencia or resolution over the consolidated disqualification cases of Ferdinand Marcos Jr. Guanzon is set to retire tomorrow, February 2, together with Chairman Sheriff Abbas and Commissioner Antonio Co. Meanwhile, Commissioner Marlon Casquejo will also be transferred to the 2nd Division on Thursday as presiding commissioner. Thus, Guanzon believes Perolino defeated her and Commissioner Marlon Casquejo's votes due to the alleged undue delay. After retirement, Guanzon's separate opinion or vote will no longer be relevant.
Commissioner Perolino did this so that both of us, Commissioner Casquejo and I, cannot cast our votes. I think they suspect that Commissioner Casquejo is also for DQ after I released my vote on January 17. So it's not just my vote that's being defeated by our junior member.
Guanzon appeals to the poll body to re-raffle the cases to a new ponente or commissioner in charge who will pen the resolution. Perolino also allegedly lose the privilege to write the decision.
Commissioner Socorro Inting will be taking my place as the presiding commissioner of the First Division, and then so she will vote on the DQ. Now, because there is this reshuffling of commissioners, this case should be re-raffled. It should no longer be in Commissioner Perolino's hands.
Commissioner Perolino, on the other hand, maintains her stand with dignified silence. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Political experts regard that the ongoing infighting between Commission on Elections Commissioners Rowena Guanzon and Amy Perolino could affect the poll body's integrity. Nelma Ribohok will tell us why.
Michael Henry Yusinko, Senior Research Fellow of the Ateneo School of Government, believes that the revelations of Commission on Elections or Comelec Commissioner Rowena Guanzon have implications on the credibility and integrity of the poll body. Guanzon, the presiding officer of the Comelec's First Division, which is handling 3 disqualification cases against Ferdinand Bongbong Marcos, revealed last week that she voted to DQ or disqualify the candidate who was convicted of an offense involving moral turpitude. She added that an influential and powerful senator was behind the delay of the decision.
Yes, Commissioner Guanzon was motivated by her pursuit of the public interest, but certainly one of the consequences of that act is undermining the confidence of the voters on the Comelec.
Yusinko said the issue should be resolved because the elections is also at stake.
Kung nagdududa tayo dun sa constitutional body na task to manage the elections, di magdududa na rin tayo dun sa election mismo, hindi ba? And pag nagduda na tayo sa election mismo, magdududa tayo dun sa mga nahalal na public officials. And that is a recipe for a political crisis and also a constitutional crisis.
This is also the sentiment of Professor Ramon Casiple, a political analyst.
Nandyan yung danger pa lang. Kailangan ayusin ng Comelec yan para maibalik yung tiwala ng mga tao.
Casiple added the Comelec chairman and other commissioners should step in to resolve the issues between Guanzon and Perolino.
Kasi yung ganitong klaseng mga pagtatalo, right to the heart ito, ng credibility ng Comelec ang pag-uusapan. Hindi ito trabaho ni Perolino. Trabaho ito ng lahat sa kanila ng commission.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
A group of health workers is calling on lawmakers to include other benefits in a proposed measure seeking to mandate allowances and benefits to health workers in times of public health emergency. Arlene Delgado will tell us why.
The Alliance of Health Workers is appealing to lawmakers to include other benefits for health workers. This comes after the proposed COVID-19 Benefits and Allowances for Health Workers Act was approved on third and final reading in both houses of Congress. Under the proposed bill, a COVID-19 risk allowance should be given to health workers every month, 3,000 pesos for health workers employed in low-risk areas, 6,000 pesos for medium risk, and 9,000 pesos for high risk. The group's president, Robert Mendoza, says this bill does not include the benefits given to them under the Bayanihan law, such as meals, accommodation and transportation or MAT allowance, active hazard duty pay, and special risk allowance.
Nalungkot lang kami dahil doon sa bago nilang pinirmahan, yung Senate Bill 2421, sumang-ayon sila doon sa suggestion ng ating Department of Health na gawin na lang itong one COVID allowance na sinasabi nila na magkakasama na po lahat per month, nakakatanggap ang mga health workers sa NCR ng 38,400 per month. And then doon sa active hazard duty pay is 3,000, yung ating SRA is 5,000. So malaki ang ibinawas dahil dito sa risk classification ay ginawa na lang low, moderate at saka high risk.
He adds the risk classification is discriminatory, noting that all workers in hospitals are at risk of contracting COVID-19.
Magkakasama kami lahat mga health workers sa isang hospital pero magkakaiba kami ng aming matatanggap. May moderate, may low, may high. Kaya nga inaayawan natin kasi ang virus naman, ito yung pinaliwanag natin na aerosol siya at airborne. Divisive, mapanghati sa mga health workers, mag-away-away yan. And then unjust pa rin siya at saka isa itong insulto doon sa mga health workers na talagang hanggang sa kasalukuyan ay kami pa rin yung humaharap sa pandemya.
Mendoza is calling on the lawmakers to include the other benefits in the final version of the law.
Sana i-adapt nila at para mapirmahan na ni President Duterte at talagang ibigay yung nararapat na mga benepisyo na dapat tanggapin ng ating mga health workers.
A bicameral conference committee will be convened to harmonize the disagreeing provisions of both versions before sending it to Malacanang for the president's signature. Jorlene Delgado, UNTV News and Rescue. We serve the people. We give glory to God.
The Metropolitan Manila Development Authority, or MMDA, will coordinate with the Department of Education, or DepEd, to discuss the resumption of limited face-to-face classes in Metro Manila. Eileen Cerudo will tell us why.
Restrictions in the National Capital Region eased to Alert Level 2 after COVID-19 cases dropped in the past few days. Apart from reopening more establishments and allowing the elderly and children in public areas, the Metropolitan Manila Development Authority is now eyeing to resume physical classes in the region.
Titingnan po namin, makikipagdialogo po kami kaagad kay Secretary Liling Briones at sa kanyang mga kasama kung baka po pwedeng ituloy na rin po natin itong pilot na po na ito.
MMDA Chairman Benjamin Abalos Jr. said the pilot implementation of limited face-to-face classes was a success before cases surged due to the Omicron variant.
Tandaan po ninyo, bago nangyari lahat ito ay meron tayong pilot at napakaganda ng pilot na natin nung araw, no? Talagang tuloy-tuloy na.
Limited face-to-face classes was temporarily suspended in Metro Manila after restrictions were heightened to Alert Level 3 in January 2022. Based on the previous statement of the Department of Education, limited face-to-face classes will resume if Metro Manila will be put under Alert Level 2. However, DepEd still has no official announcement if it will allow the resumption of physical classes. Meanwhile, the Commission on Higher Education, or CHED, previously stated that higher education institutions can resume classes on January 31. However, several universities and colleges decided to reopen classes this February. CHED gave higher education institutions the discretion to resume physical classes as long as they have the capacity to implement health and safety protocols and ensure teachers and students are safe from COVID-19 infection. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
All local government units in Metro Manila are making their vaccination sites more child-friendly. Janice Inhente reports why.
For children to be less anxious and make them comfortable on the day of their vaccination, Some local government units have made their own strategy, making their vaccination sites a child-friendly venue for children who will get vaccinated against COVID-19. In Mandaluyong City, the designated vaccination site at the Podium Mall will comfort the children with the festive-themed setup.
Ang setup namin, nung nakita ni Envo kahapon, is festive atmosphere para hindi matatakot yung mga bata. 500 a day lang muna. Kasi medyo bago yan. Baka iba yung mga bata maliliit eh. Mahirap pagpakuna sa ganun.
In Parañaque City, the LGU prepared a welcoming environment for children in their 2 vaccination sites at SM Sukat and Ayala malls. The LGU also assures that their selected venue was close to the hospital for immediate medical attention in case there is an adverse event of vaccines to children.
Gagawa na lang kami siyempre ng konting gimmick, pero pag nasa mall ka naman, parang pati yung ambience mo, parang medyo parang namamasyal ka di ba? Tapos maayos naman yung vaccination area, maliwalas.
In Manila City, the newly renovated Manila Zoo will be used as vaccination venue for children. They can visit the zoo after getting their jab. Those who want to be vaccinated here must register twice. First, at the city's COVAX website for an appointment, and second, at the Manila Zoo website to get into the park. In Makati City, the city plans to equip its 2 vaccination sites at SM Makati and Nemesio Yabot Elementary School with TV monitors and tarpaulins to get kids' attention during the vaccination day. In San Juan City, the LGU will exclusively use the Phil Oil Flying V Center for vaccination of children because it is spacious and comfortable. San Juan LGU targets to vaccinate the 5,000 children who have registered in the city within 7 days. According to the Department of Health, it is necessary to prepare vaccination sites to be used suitable for children in order to condition their mind and avoid panic and fear during their vaccination day.
Kailangan handa yung area for whatever happens during the immunization para na maging pleasant yung ating experience ng ating mga kabataan.
Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Days after it concluded its 18th hearing on the alleged questionable medical supply deals of the government, the Senate Blue Ribbon Committee has released its partial committee report recommending the filing of charges against several individuals. In the executive summary released to the media, the filing of charges are recommended against former officials of procurement service of the Budget Department, namely Lloyd Christopher Lau and attorney Warren Leong, for supposedly illegally favoring an underfunded and unqualified supplier. The charges include violation of Anti-Graft and Corrupt Practices Act, plunder law, frauds against the public treasury, and Government Procurement Reform Act. Similar charges with alleged violations of the revised Corporation Code are also recommended by the committee against the officials of formerly Pharmaceutical Corporation, Wang Tuyen, Mohit Dargani, Twinkle Dargani, Lincoln Ong, and Crizel Grace Mago. Estafa charges are also recommended against Mago and Mohit Dargani. Meanwhile, Health Secretary Francisco Duque III is also included in the list with the recommended charges for alleged violation of Anti-Graft and Corrupt Practices Act and plunder law. The report also shows a recommendation to filing of cases to support the deportation of former presidential economic advisor Michael Yang. Based on the partial report, President Duterte betrayed the public trust for several actions, including the appointing of Michael Yang and seeking to discredit the Commission on Audit. Duque and Malacanang has yet to release a comment on the matter. Attorney Ferdy Topacio, one of the legal counsels of formerly executives, calls the committee a kangaroo court, which has, quote, morphed into what is practically a one-man committee dominated by Senator Gordon, end of quote. Topacio adds he is confident that the evidence will lead the eventual acquittal of his clients from the charges recommended by the Senate Blue Ribbon Committee before the courts. Meanwhile, Yang's legal counsel, Attorney Raymond Fortune, says the report's conclusions have no legal nor factual basis. For Fortune, it was not done in aid of legislation, but solely for re-election. Fortune says the former presidential economic advisor is looking forward to the report being handled by an impartial investigation body.
For the news abroad,
The United States, United Kingdom, and Canada placed sanctions on the top Myanmar justice officials on the one-year anniversary of the military coup. Maeve and Doug will give us the details live. Good evening, Maeve.
Good evening, Elsie. The US, UK, and Canada on Monday placed sanctions on Myanmar's top justice officials to hold them accountable for the violent military coup that took place in the country 1 year ago, with the announcement marking the coup's one-year anniversary. The US Department of Treasury announced sanctions against Attorney General Thida Aw, Supreme Court Chief Justice Tun Tun Aw, and Anti-Corruption Commission Chairman Tin Aw, who were said to have been heavily involved with the unjust prosecution of the opposition leader Aung San Suu Kyi. These officials were accused of using their positions to abuse the law and remove their oppositions, which resulted in a breach of international peace and security. U.S. Secretary of State Anthony Blinken stated that all three nations have coordinated this joint action to show their strong support for the people of Burma and against the violence instigated by the military. Blinken further added that the U.S. will continue to fight for human rights with a goal to bring Burma back to democracy. British Foreign Secretary Liz Truss, in unity with the U.S., declared their priority to also defend the right to freedom against brutal regimes. The U.S. Treasury reportedly placed additional sanctions on 7 other individuals. So far, according to the Canadian government, the military had shown no signs of reversing their humanitarian and political course. Elsie?
Maeve, what do these sanctions mean for the Myanmar officials?
Elsie, these sanctions will freeze all assets of the penalized justice officials, heavily restricting the junta's access to financial sources. Businesses supporting the military have been blocked. Additionally, they are banned from traveling to the UK and are barred from doing business with the US. Back to you, Elsie.
Thank you, Mavian Dog, reporting live from Australia. Teens and preteens in the U.S. may have lost about 200,000 years of life to unintentional drug overdoses, according to a new study. The study, published in JAMA Pediatrics on Monday, may be one of the first to calculate lives lost to unintentional drug overdoses among young people. In one 5-year period between 2015 and 2019, researchers looked at overdose data from the U.S. Centers for Disease Control and Prevention to calculate the total number of years of life lost for 10 to 19-year-olds who died during that time. If the data is expanded to include people up to 24 years of age, unintentional drug overdoses resulted in the loss of 1.25 million years of life. Furthermore, the number of young people dying from unintentional overdose has steadily increased in recent years, according to data from the National Institutes of Health. The British government considers changing the vaccine rules amongst health workers. The policy requires all health staff to be fully vaccinated by April 1, which means they should receive their first shot this week to meet the deadline. More than 75,000 health workers have not had a COVID vaccine based on NHS data, but the policy have met resistance from some health workers and even a number of lawmakers in the Conservative Party. People across the United States to Ukraine also argue that such rules violate human rights. Now, Health Minister Sajid Javid announced recently that the UK government will revoke the regulation. He says the vaccination policy is no longer proportionate to require COVID jabs as a condition of employment. Australia Prime Minister Scott Morrison is set to make an announcement that aged care workers will receive bonus payments amounting to $800 Australian. Marvi Delphine will tell us why live. Yes, Marvi?
Elsie, the federal government made a commitment to provide a $210 million package to support the aged care workers who are struggling due to the COVID-19 pandemic. According to a statement released by Minister of Health and Aged Care Greg Hunt, this is in recognition to the dedication and resilience of the said workforce. These bonus payments would give around 234,000 aged care and clinical workers bonuses amounting up to $800 in 2 installments. The first will be accessible within weeks and the second in May. Moreover, according to Carolyn Smith, the director of the United Workers Union Aged Care, they are pleased that the bonus would be extended to all aged care workers, including food and cleaning staff. Meanwhile, the official announcement regarding the bonus payments has been made by Prime Minister Scott Morrison in his speech today to the National Press Club. Elsie?
So Marvy, how can the aged care workers apply for the said bonus payments?
Elsie, aged care providers will need to apply for the bonus and pass on the assessment to employees. Minister Greg Hunt encourages providers to make the bonus to eligible employees as soon as possible after the confirmation of the amount. Back to you, Elsie.
Thank you, Marvy Delphine, reporting live from Australia. And those are the reasons behind the news in other parts of the globe. I am Elsie Marcos, live from Auckland, New Zealand. Good evening.
A single mother in Ghana, Africa, wishes for a livelihood to support her children, especially her daughter, who has an illness. Thanks be to God because her wish has come true. Here is the story of how Agnes Kuma witnessed that MCGI cares.
– 70-year-old Agnes Kuma lost her husband 25 years ago. Now she is left alone to support her children in their hometown in Volta region, Ghana, Africa. When there's no harvest, her family depends on other people who lend a helping hand. Agnes has a daughter who had been left by her husband and has been suffering from epilepsy for 25 years now. Agnes wishes to have a livelihood in order to make ends meet and to care for her sick daughter even more. Agnes in supporting her family, members Church of God International granted her request. Now she has something to sell and make a living. Penamao, thanks be to God for His loving kindness and for granting Agnes's wish through His blessings. For the Lord is good, His mercy is everlasting, and His truth endureth to all generations. Praises be unto Him for His goodness. And this goodness is what MCGI will uphold and share with faith, hope, and love to people who believe in God's love. Because MCGI cares.
Before we close, we will leave you with a word, giving glory to God. From the book of Proverbs, chapter 3, verse 12. It says, "For whom the Lord loveth, He correcteth, even as a father, the son in whom He delighteth." And those are the reasons behind the news, February 1, 2022. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.